The history of humanity is interwoven with pandemics. These invisible enemies have swept across the globe, leaving devastation and despair. From the Black Death to the 1918 influenza, infectious diseases have shaped societies and decimated populations. Yet, humanity has shown remarkable resilience. We have learned, developed new tools, and emerged stronger. Pandemics have often catalyzed scientific advancements. Quarantine measures and sanitation innovations arose from past outbreaks. The story of pandemics is a testament to humanity's spirit. We must remember past lessons to face future threats. It is our responsibility to ensure sacrifices and knowledge are not in vain. We must build a more resilient world. The history of pandemics is a reminder of our vulnerability and hope. The 1918 influenza pandemic, often referred to as the Spanish flu, casts a long shadow over the annals of modern history. It stands as a chilling reminder of the devastating power of infectious diseases, even in an age marked by significant scientific and technological progress. The pandemic, which emerged in the final year of World War I, swept across the globe in 3 deadly waves, infecting an estimated 500 million people and claiming the lives of at least 50 million, more than the total number of casualties from the war itself. The origins of the 1918 influenza virus remain shrouded in mystery, but its impact was undeniable. Unlike seasonal influenza, which typically poses the greatest risk to the very young, the elderly, and those with underlying health conditions, the 1918 pandemic disproportionately affected healthy young adults. The virus attacked with a ferocity that overwhelmed the medical capabilities of the time, leaving doctors and scientists baffled and helpless in the face of its relentless spread. Hospitals overflowed with the sick and dying, while cities and towns ground to a halt as fear and panic gripped the population. The world had never witnessed such a deadly and swift-moving pandemic, and the lack of effective treatments or a vaccine exacerbated the crisis. Public health measures such as mask wearing, social distancing, and quarantine were implemented with varying degrees of success, but the sheer scale and virulence of the virus overwhelmed even the most robust efforts to contain it. The Spanish flu pandemic exposed the fragility of human societies and the limitations of medical science in the early 20th century. It served as a stark warning of the potential devastation that could be unleashed by a novel and highly contagious respiratory virus. The pandemic's legacy extended far beyond its immediate death toll, shaping public health policies, influencing scientific research, and leaving an indelible mark on the collective memory of a generation. As the crisis deepened, societies around the world faced unprecedented challenges. Hospitals were overwhelmed, economies faltered, and everyday life came to a standstill. But amidst the chaos, a turning point emerged. Communities began to adapt, finding new ways to connect and support each other. It was a time of great hardship, but also of remarkable resilience. In the face of such a global challenge, it became clear that no nation could stand alone. A call for global solidarity echoed across continents. Leaders, scientists, and citizens alike recognized that cooperation was essential. Sharing knowledge, resources, and compassion became the pillars of a united response. Together, the world began to forge a path towards recovery and hope.